Hello and welcome in. I'm Dan Edwards, your moderator for today's Kettering Health Chats, and a live interactive forum to answer your questions with our Kettering Health expert. Yes, we are making house calls tonight. Great to have you with us, or from wherever you're joining us. We do appreciate your company here on this Facebook Live event, kind of co-cast with WHIO as well as Kettering Health. Now, today's topic is colon cancer prevention. And if you have any questions for our Kettering Health expert on colon cancer prevention, we ask you to right now go ahead in your chat segment. Please submit your questions right now. Yes, use that chat feature of Facebook. Chris and Zach, our director, are going to be relaying as many questions to us as possible for the doctor to answer here in the next 30 minutes. Yes, we've only got 30 minutes to get those questions answered, so please don't delay. Chat now. It's like a free consultation for you. So again, we're going to share your questions and comments and concerns with our Kettering Health expert. And again, our important topic tonight, colon cancer prevention with our Kettering Health expert today, Dr. Minia Hellan. And Dr. Hellan is a special interest in gastrointestinal oncology, including esophageal, stomach, and pancreatic cancers, as well as a passion for the treatment of colorectal cancer. And Dr. Hellan is a well-known and respected researcher in surgical oncology. And Dr. Hellan, welcome to Kettering Health Chats. Great to have you with us tonight. No, this is where you say hello. And
good evening, everyone.
Show us that smile. We appreciate you being with us tonight. Now, gastrointestinal health might not be everyone's favorite topic, may not be one of those topics that we start at a party conversation, but it's important because the risk of colon cancer is tremendous. And so we're going to be talking with the doctor today, and talking with her tonight literally could save your life. I mean that. And let's just start, doctor, with who gets colorectal cancer and who gets colon cancer? Where do we start?
Well, I would say, unfortunately, any one of us can get colon cancer. And just to clarify, when we talk about colon or colorectal cancer,
right,
we are talking about the large intestine, which is starting in the right-sided abdomen and goes all the way to the very end of our GI tract, and that's the rectum. So they are called colorectal cancers, but the treatment and the diagnosis for a colon cancer on the right side may be a little bit different than for a rectal cancer. But today the topic will cover colon and rectal cancer.
Okay, appreciate that. Now, let's take a look at slide 2, which is survivability. And you have some interesting facts here, Doctor. Walk us through this slide, if you would, please.
Yeah, so colorectal cancer is one of the leading cancers that we have nowadays. And it is actually a highly curable cancer. And what you can see here on this slide is that if you diagnose a colon cancer early, you have a more than 90% chance to be actually cured from your cancer. Mm-hmm. Unfortunately, only about a third of the patients that I see will present in an early stage. And if you have advanced stage, unfortunately, your chance of cure will decrease as more advanced your stage is. And that is why finding colon cancer and trying to prevent colorectal cancer is so important. What you see further a little bit on these other numbers, overall the incidence of colon cancer is about the same, slightly decreasing. However, there is really an increase in colon cancer in the younger patients. So patients below 50, so between 40 to 50, as well as patients between 30 to 40 now have an increased risk of colon and rectal cancer.
Walk us through those risk factors for colorectal cancer as well, please.
So in general, we always think that colon cancer is more associated with older patients, and that is true. So a big part of colon cancers are found in older patients in the 70s and 80s, except as I just mentioned, we are noticing an increase in younger patients as well. But old age is one of the risk factors. Then anytime you have a personal history of a cancer or colon cancer, or a family history. So that is very important that you know about the family history. Then certain other diseases of your bowels can increase your risk for colon cancer, and that is usually inflammatory bowel disease, that you understand Crohn's disease and ulcerative colitis. Then there is a very small group of colon cancers, about 5% of colon cancers, that are truly genetic. And there's a couple of genetic syndromes, such as Lynch syndrome, where you have a very high likelihood of getting colorectal cancer in your own lifetime. And then a couple of additional things, such as diabetes and also your ethnicity.
Okay. You have, we were talking earlier, and you were saying African Americans and the Indian population are seeing an increased risk in colon cancer. Do you have any attributes for that?
No, I mean, I don't think so. It's very interesting. Colon cancer is a little bit more common in men than in women. And it is most common in the African American community and in the Native American Indians. And then white, non-Hispanic, these are the three population groups that have the highest incidence of colon cancer.
And you see men there a little bit higher. Is there a reason why men are a bit higher than women? Do they have not as good dietary habits as women do?
I don't think we can simplify it that much, you know. But no, I really don't necessarily know.
Right.
When we talk about some of the other risk factors, there may be an influence. But this is what we see when we look at the numbers in our population. Who gets colorectal cancer most commonly?
Gotcha. Well, what are the, I guess we need to start as well as folks you are tapping in the chat box there to give us questions that you might have. Share with us, doctor, what are the early warning signs? I mean, what are we looking for?
Yeah, and I think that's really important. Some of the colon cancers, especially more on the right side of your colon, you may not notice very early on. They may bleed a little bit, but because it's in the right side of the colon, you won't see any blood in your stool. You may see some dark stool. You may feel tired. You may get anemic. So in my opinion, everyone who develops anemia that is contributed to blood loss and is at least above 40 years of age should have to be checked for colorectal cancer. That's one of the main causes for anemia. Then as you move more towards the left side in the colon and the rectum, you will start noticing change in your bowel habits, urgencies. You have to start going to the bathroom multiple times a day. You can't evacuate. You constantly have the feeling that you need to go to the bathroom. This is what you notice, especially in rectal cancer. And then you can, of course, get real bleeding, where you see blood in your bowels, and that is another warning sign. One of the other things you may notice that you start losing your appetite, you start feeling bloated, and unconsciously you stop eating and start losing weight. That could be an advanced sign for more advanced colon cancer.
Weight loss is an indicator. Interesting. Well, obviously, regular colonoscopies are a vital component to reducing your risk of colon cancer, correct?
Yes.
And so when you see any of these signs, obviously you would probably advise to immediately call your primary care physician, I'm assuming, correct?
Yes, I absolutely encourage everyone to not hide those signs, because unfortunately I see a lot of patients, especially younger patients, that just say, oh, it will stop, it's just a hemorrhoid that's bleeding, oh, it will be fine. And then 6 months go by, and then we have a significantly more advanced cancer. So I think it is really important to take those warning signs serious and talk to your healthcare provider about it.
Well, doctor, we have our first chat question here from one of our viewers, and thank you for your participation. Jen, she says, doctor, can you talk about the benefits of a well-balanced plant-based diet in regards to colon disease and colon cancer?
Well, that is a very good question. Yes, it is. And that actually links to two of those things, what can cause colon cancer. And as far as we know, our diet that is unfortunately not very plant-based increases the risk for colon cancer. So colon cancer is related to lifestyle, to diet, and diet modifications are one of the main modifiers you can do in your life to decrease your risk of colon cancer. And we do know that a diet low in vegetables and low in fruits increases your risk of colon cancer. You should try to eat more whole grains. So one of the problems is the refined grains. So vegetables, any kind of greens, vegetables, beans, fiber, fruits will decrease your risk of colon cancer and is good for your colon in general. And the other risk is actually very processed food and red meat. Red meat and processed meat seem to be an indicator or a risk factor for developing colon cancer.
Boy, you see that graph there. I'm 62 now, doctor, and avoiding weight gain as an adult has been a huge challenge for me. I try to watch what I eat and I try to get my exercise, but doggone it, it's tough to keep that weight maintained. Any sympathetic things that you can say to me other than just keep at it, watch what you're eating, so on and so forth?
Well, and I think that binds to what we should be eating. You know, we should really focus on a more plant-based food type diet with whole grains, and that would also help you to control your weight. And we are not talking about extreme weight loss. We are talking about a healthy weight for your body. As we all know, that will contribute to better blood pressure control, blood sugar control. We know diabetes contributes to colon cancer. So it's really this entire problem of obesity, extreme weight, and unhealthy diet that does not only cause the colorectal cancer, but many of our other problems. So yes, trying to keep your weight in a healthy range, that should be your goal.
Yeah. So if we have these colonoscopies and the tests are becoming easier and easier, we'll talk more about that in just a little bit. Why are so many patients hesitant to get a colonoscopy? They know how important it is. I mean, how do you get them over that? Because, I mean, there is a bit of privacy that goes with that. But what do you tell your patients that, the importance of getting a colonoscopy early?
Well, so I have done my own colonoscopy. I mean, I have had it, and I can tell my patients, in all honesty, it was a very pleasant experience. You will have a little sedation. There is no pain involved.
Right.
Of course, colonoscopy is an invasive procedure, and you have to go to the doctor's office. The most uncomfortable is probably doing the bowel prep before the colonoscopy.
Yeah.
But I think there are many different kind of bowel preps, and you can talk to your gastroenterologist. I did not find it too difficult, and as I said, there are different options. And the colonoscopy itself nowadays, in the modern era of sedation, you will not feel anything.
Right.
They drive you in the room and you will wake up and your colonoscopy will be done. So I really think there is nothing to fear, and it can really save your life.
No question. Unfortunately, I lost my sister to cancer, and one thing that she insisted upon before her death was that, I was coming up on age 50. She insisted I get one. And when they first started, they weren't the most pleasant to go through, but they have gotten better. I mean, before you'd have to drink this chalky stuff that was horrible, but now it's not enjoyable, as you said, but it is much more pleasant.
Yes. And there are also other tests you can do. I mean, if there's really big reluctance about doing a colonoscopy, you're elderly and you have kidney disease, and drinking a lot of liquids can have some side effects for you. We do have other options to screen for colon cancer.
Yeah. So I don't know if this is germane, but has COVID impacted this topic at all?
Yeah, unfortunately, and as I'm a specialist and I see a lot of colorectal cancer patients, especially this year, we had a really big increase of patients with very advanced colon cancer and then very symptomatic colon cancers. Because last year, and when COVID started, a lot of the screening stopped, a lot of the colonoscopy stopped. So now we are facing a patient population that has more symptomatic disease. And I truly noticed that this year, that we have much more advanced colon cancers, and I do believe that has to do with the fact that we did less screening colonoscopies last year.
Wow. So even just, 16, 18, 20 months can make a huge impact on the outcome of that cancer.
Yes, if you remember that first slide of a chance of a cure for more than 90%, which is now reduced down to perhaps 30-50% with an advanced colorectal cancer.
Again, another chat question coming in here in Lloydston says, is it true I should limit my intake of red and processed meats? And I think you covered that, but boy, how tough is that during the holidays? I know it's a habit that you have to form, but it's really difficult but you got to limit that stuff.
Yeah, I think you should, but I think how I see it, that you should really just have a very healthy, balanced diet. So the main part of your diet should be fish and poultry and white meat and the vegetables, beans, and there's nothing wrong in having a red meat from time to time. You actually need some iron.
Yeah, absolutely, sure.
And having some ham and some, hot dogs, those type of things. But should you have a hot dog every day? Probably not. And I think that's where we're struggling a little bit. In just trying during the week to focus on the non-red meat groups, we have so many options of delicious foods, and then really limit your red meat intake to perhaps once a week or so.
And the activity too is huge. You see the PlayStation there, and we've got so many kids, and that's why we're seeing younger and younger cancer patients, correct?
Yeah, I mean,
you think?
Yes, yeah. There's very good data, not just for colorectal cancer. I think there's really good data that the overweight and the weight gain we have in our society nowadays increases the risk for probably at least 15 different kind of cancers, from colorectal cancer to breast cancer to endometrial cancer for us women. And there is clear data that a sedentary lifestyle, sitting in front of the computer, not moving, increases your chance of getting those cancers. It also decreases your chance of surviving those cancers and increases your likelihood to dying from those cancers. So when I talk to my cancer survivors, I always put a program together that also increases their activity, and next to the diet that we just talked about, to increase their activity.
Right. Doctor, I know this is strictly speculation on your part, but you're the expert. With so many people now working from home, do you think this is going to have an adverse effect on some of these charts and graphs that we're showing?
Well, that's difficult for me to say.
Sure,
Perhaps
sure.
now as we're at home and we have things such as Peloton and fancy apps that will guide us to get up and move around, and we have a Fitbit watch. I mean, alone when we talk about activity, it doesn't mean that you have to go and run a marathon tomorrow. It would just really mean to get up, to walk up some stairs. You can have your Fitbit watch. You can try to get your 8,000 to 10,000 steps in a day. Ideally, you should have about 20 to 30 minutes of exercise a day where you bring your heart rate up a little bit, and you could talk but not think, if you want to say it that way. So doing some heavy housework, going out in the garden, walking your dog, but walking briskly, that would be considered activity. And
Well, see, doctor, I do what I call wogging. I walk with a little jogging, so it's wogging. Whatever, just do something, you're saying, right?
Yes, and that you should do about 300 minutes, about 5 hours a week of real body activity. If you do, it's called moderate intensity. And then, of course, if you do high intensity, let's say you're a runner, you go really running, or then probably about 2-3 hours a week would make a difference when we look at cancer outcomes.
Okay, I wanted to get back to the age factor. Your family history of cancer is huge. You've got to keep an eye on that. If you don't know, ask your grandparents, ask your parents what's going on. If you haven't already, schedule your colonoscopy sooner. Now, for instance, if it used to be that you would get your colonoscopy at 55 or 50, you're saying now it's 45. But if you have someone, if you have a history in your family of cancer, you're saying maybe do it even sooner.
Yeah, so the recommendation for colonoscopies have recently changed, especially because we are seeing so many younger patients.
Right.
So the latest guidelines are to start a screening colonoscopy at the age of 45.
45.
Now, if you have a family member, a first-degree family member that would either be a parent or a sibling with a colon cancer, you should actually start your colonoscopy at 40 or 10 years before the age of your parent or your first-degree relative. So if your mother had a colon cancer with 40, then you should actually get a colonoscopy at the age of 30.
Okay. So So genetics very much determine whether you are at risk of colon cancer. So if you have it, with these DNA tests now that we have that we can go back in our family tree, is that a helpful resource for people?
Well, I think that can be a little bit misleading.
Okay.
We do know about 20% of colon cancers will be in families that have some family history, but they are still not necessarily genetic. We call it a clustering in a family. And only 5% of colon cancers are truly genetic. And then you really have, there are certain criteria, but usually you have a very strong predisposition of certain cancers. And for the Lynch syndrome, for example, it is endometrial cancer, colorectal cancer, and then also pancreatic cancer that can be very strong in your family. And the other family syndrome is a polyposis syndrome, and usually you have hundreds and hundreds of polyps, and that is diagnosed quite early. In the 20s, this kind of syndrome, but that is only 5% of colorectal cancers. So you still have the same risk than anyone else of us, even if you don't have a family history.
Understand. All right, so age, family history, certainly all risk factors for colon cancer. What else should we be looking for? Or is there anything else that we haven't covered?
Yeah, so if you had polyps or someone in your family has polyps, so there seems to be a little bit of a predisposition in the family as well, and the recommendations are the same. If you or your first degree relative has polyps in the colon, you should also get your first screening colonoscopy at the age of 40 and not 45. Once you have had a polyp, let's say I get my first colonoscopy at 45 and they find a couple of polyps in my colon. Then depending what kind of a polyp and how many polyps you have, you will have to repeat your colonoscopies a little bit more often. So usually it's somewhere between 1 to 3 years that you repeat your colonoscopy. If your first colonoscopy is clear and you do not have a family history, your next colonoscopy just has to be in 10 years. Okay. If you have a family history, then they will usually recommend, or I would like to recommend in 5 years to do a colonoscopy every 5 years.
Okay, that's good information for sure. I wondered about that as well. Doctor, take us through the timeline. How long does this process take from diagnosis to getting the screening and getting the results, hopefully positive results?
You mean like how long it takes from a
Yeah,
polyp?
I mean, is it a couple of days, a couple of weeks? What when you see something or you fear something, what's your recommendation as far as timeline for procedure?
Well, I mean, I think that really depends how symptomatic you are.
Okay.
And we haven't mentioned yet there are other tests that you can do when you are suspicious. You can talk to your primary care physician. There are blood tests stool tests for blood. There may be a pre-screening, but if you have a positive stool test in the blood, then you actually need a colonoscopy. Mm-hmm. There is now a new genetic DNA test that can be done in your stool that has a very good sensitivity. It is difficult sometimes to get immediately to a colonoscopy.
Okay.
Because the gastroenterologists are backed up as well. So I think your first way should be to talk to your primary care physician. If you can't get immediately on for a colonoscopy, you can at least start with like a stool test and a blood test. There are options of doing a CT colonography, which is actually a CAT scan rather than a colonoscopy.
Really? Okay.
Yeah. But it also requires to do a bowel prep. But that may be an option if for whatever reason we can't get a colonoscopy done. If you're very symptomatic and you really have problems, then coming to the hospital may sometimes be needed. Okay. And if a patient gets admitted to the hospital and we have a high suspicion, we can usually get our colonoscopy done within a day or two of admission, so we know what is going on.
That's super. We have such good health care in this community, and Kettering Health is certainly a leader there. We're kind of running out of time here, and I wanted to get to another question here from the chat. Kate asked this question, Doctor. She says, a popular colon cleanse being advertised on YouTube right now is called Zupu. Do you have any ideas on the product and similar products in terms of efficacy for prevention? Are you familiar with that product?
Well, I don't know this product, but I have seen a lot of different products for bowel cleaning and colon cleaning. There is absolutely no data that this will prevent or protect you from colon cancer.
Fair enough.
I actually do believe that it may be more harmful. We learn a lot about the natural biome and the natural bacteria of the colon. And by doing all those cleanses, I think you destroy the natural flora of your colon, which may increase your risk, which may actually increase your risk for colon cancer.
Okay. Another question, Doctor, if you will. Jen, is there any benefit of supplementing vitamin D3 in regards to colon cancer prevention? That
is a very good question, and that is a hot topic. It's a hot topic of research. there is some data suggesting that if your vitamin D levels and your calcium levels are low, that may increase your risk of colon cancer. It is not 100% clear how much vitamin D you should be taking or how much calcium. Too much calcium can actually increase the risk for prostate cancer in men. But I think there is good suggestion what we know nowadays, that keeping your vitamin D levels in normal levels or like in the high normal range could be beneficial in preventing some colorectal cancer.
All right, so good news. Screenings are safe and easy. They're getting better all the time. We looked at those testing options on slide 5, and more good news, we're catching it earlier in the process, and our treatments are better. So survival rates are increasing, which is good news. But again, I think we need to go back to slide 7 if we could. And let's talk and kind of finish up with what we can do to leave you in healthier condition here as far as more healthy choices. You say fruits and vegetables, God's fast food, are one of the best things that we can have, correct?
Yeah, so I think I think lifestyle changes. There are 5 things that you can do to improve your life in general and decrease your risk not just for colorectal cancer, but many other cancers, cardiovascular disease, diabetes. And that is a healthy weight, physical activity, we talked about that, non-smoking, because smoking does not only increase the risk for lung cancer, it's also linked to colon cancer. Limit your alcohol consumption. We do know that heavy alcohol consumption can increase the risk for colon cancer and other cancers, of course. And then a healthy diet, and our diet should be more plant-based, whole grain, more white meat than red meat.
Can you clear up? It seems like we're getting somewhat conflicting research when it comes to having wine. You see one study that says a glass of wine is good for you every day, and then another study says, not so much. And coffee, good or bad? What are your thoughts on that, doctor?
My thought, when you look at the latest guidelines, everything in moderation.
Everything.
You know, it's the same like a piece of steak. I like a good piece of steak
Right,
from time to
exactly.
time, but it is moderation. So a glass of wine a day, how much will it protect us or not? But it shouldn't,
Sure.
at least I don't think it will do as much harm. Should you be drinking every day a bottle of wine? Absolutely not. And I think that's how I take it.
Sure.
You know, to have a glass of wine from time to time, I think is very reasonable. Coffee seems to have some influence that, you know, there are some data suggesting it may protect us from certain cancers. But, you know, it's difficult to say, to make a recommendation, drink 5 glasses of coffee a day now.
Right.
But there is some suggestion that it may have a positive influence at least.
Well, you know, I feel God has put everything on this earth for us to enjoy, but the key is moderation, right?
Yes, that's
right.
how I see it, yes.
Well, what details, if we sense something is wrong, what details do we need to discuss with our primary care physician, or do we go directly to an expert like you?
Well, I would say the first person to contact is probably your primary care physician, because most of the time you will need a referral to a surgeon and referral to a gastroenterologist. I think some insurances may allow you to directly contact the gastroenterologist to get screening or get screening colonoscopies. I think your primary care physician is probably the first person to talk to.
Okay, very good. Well, Dr. Hellan, thank you so much for this great information. We appreciate your time, we appreciate your expertise, and obviously your passion for this very important topic. Thank you very much.
Thank you, and good night, everyone.
Well, kind of our call to action now, if you want more information about the topics that we've discussed tonight and some of the secrets on what to do to keep you, not really secrets, but some of the things that can keep you and your loved ones healthier, please go to ketteringhealth.org/cancer care. So we hope that you'll join us next time. We're going to continue to do these in the new year, and we hope that you'll kind of tune in and be a part of these Kettering Health Chats live. I'm Dan Edwards, and we do appreciate you joining us for this live conversation. And on behalf of all of us here, we hope you have a safe and happy and healthy holiday season. And we'll see you next time on Kettering Health Chats. Yes, Kettering Health. We want you to be your best.